Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Today's topic is about type 1 hypersensitivity and anaphylactic reaction. We will cover successively the antigen-antibody reaction, the type of immunoglobulin, type of hypersensitivity reaction, type 1, type 2, type 3, and type 4, primary mediator, histamine, protease, neutrophil chemotoxic factor, eosinophil chemotoxic factor, and secondary mediator, cytokine, prostaglandin, platelet activator factor. We will cover cells involved during this hypersensitivity. First, antigen present in cell. Second, T helper cell. Third, B cell IgE. Fourth, basophil and mast cells. 5, eosinophil cells. 6, neutrophil cells. 7, macrophage cells. 8, epithelial cells. From the blood, we can separate the plasma and cells. There are 3 types of component of cells: platelet, WBC, and RBC. White cells, there are lymphocyte and monocyte. Lymphocyte, there are B lymphocyte and T lymphocyte. The first contact with the antigen is a macrophage. Then it gives a signal to B cells, and B cells itself gives signal to T cells and to plasma cells. Plasma cells synthesize immunoglobulin or antibody. Five categories of antibody. IgA are dimeric. IgM are pentameric. IgG and IgE and IgD are monomeric. Dimeric, pentameric, monomeric. There are 4 types of hypersensitivity reaction: type 1, type 2, type 3, and type 4. Type 1, 2, and 3 interfere with antibody. Type 4 interfere with cell-mediated. Type 1, antibody are fixed in basophil. Type 2, antibody are free. And type 3, there is free immune complex. Type 4, cell-mediated. I repeat, type 1, antibody are fixed to basophil. Type 2, antibody are free. Type 3, antibody are free as immune complex. And type 4, there is no antibody, only cell-mediated. This is the chronology of event. If an antigen like a pollen comes into the respiratory system, it follows all these steps, and let's see. This is the bronchial section with a mucosal lining and secreting gland. There are smooth muscle around, blood vessel, and mast cell. The antigen, which in this case is a pollen, is coming in the lumen. Normally, in macrophage, pollen is broken down to fatty acid and completely destroyed. No immune response. For patients genetically programmed, chromosome number 6, making MHC2 class 2 molecule, present antigen will be not destroyed. It will be presented to the immune system. Pollen antigen will express at the surface of the macrophage. Lysozyme break antigen only partially. Patient genetically programmed chromosome number 6, making MHC2 class 2 molecule, and antigen will not be destroyed. It will be presented to the immune system. Pollen antigen will be expressed at the surface of the macrophage. There is TCRT, T cell receptor for the antigen. There is a T cell receptor for the antigen, and it recognizes the antigen. It induces the formation of CD4 molecule, which reacts with class 2 molecule. CD4 induces the formation of CD3, and CD3 induces the formation of interleukin-2, which connect with the receptor of interleukin-2. These phenomena lead to clone expansion. This clone expansion lead to the formation of interleukin-5 and interleukin-4. Interleukin-5 increase massively and produce immunoglobulin E. Interleukin-4 act in B cells to produce a clonal expansion of B cells. The clonal expansion of B cells lead to the formation of interleukin-5. Interleukin-5 act in plasma cells to produce a huge amount of IgE. Plasma cells and mast cells produce a huge amount of immunoglobulin E during a period of 10 to 12 days. Until now, all the phenomenon is silent. There is no symptom until now. If the patient is in touch with antigen for a second time, there are 3 signals that occur. The first signal go to cytosol preformed primary mediator. The second signal lead to mediator cytotoxin, and the third signal lead to mast cell membrane to produce phospholipase E2 and arachidonic acid. Let's start with the first signal. Already presensitized mast cell basophil loaded with IgE against the pollen. As soon as antigen bind with a mast cell, there will be explosive response releasing mediator. Pollen make a bridge between IgE and intracellular signal comes. Granules go to the surface of the cell and release production. This initial phase reaction go to primary mediator with preformed histamine neutrophil chemotoxic factor, eosinophil chemotoxic factor, and protease. C3e and C5e receptor of mast cell stimulate further release for amplification of loop. The second signal is for mediator cytokine. The second part of hypersensitivity B cells have surface receptor BCR, stand for B cell receptor of antigen. This receptor of antigen bind with pollen and make the interleukin 4. Interleukin 4 lead to B cell growth factor. Pollen-sensitive B cells start multiplying as a clone, giving expansion of B cells. Now we are at the stage of the third signal. Third signal, stimulation of mast cell membrane enzyme lead to break with phospholipase A2 break down phospholipid into arachidonic acid. There is lipooxygenase lead to leukotriene and cyclooxygenase lead to prostaglandin. Leukotriene C4, leukotriene D4, and leukotriene E4 as group are the most potent vasogenic and spasmogenic known until now. It's the slow reactive substance of anaphylaxis, 1,000 times more powerful than histamine. Membrane phospholipid lead to arachidonic acid by phospholipase A2. If it goes to prostaglandin with cyclooxygenase, giving powerful stimulant for gland. If with lipooxygenase, it goes to leukotriene. Leukotriene C4, leukotriene D4, leukotriene O4, all slow reactive substance of anaphylaxis, 1,000 times more powerful than histamine. Eosinophils are bilobed nuclei. It gives interleukin 3 and interleukin 5 to eosinophilic cationic protein. Don't forget epithelial cell with eutaxin, major basic protein. Platelet activating factor. Platelet activating factor is a potent phospholipid activator and mediator of many leukocyte function, plaquette aggregation and degranulation inflammation, and anaphylaxis. Histamine is vasodilatator, endothelial shrink increase permeability, edema in submucosa, spasmogenic smooth muscle becomes spastic, lumen will be reduced, histamine contracts smooth muscle, reduce lumen, histamine stimulates glandular secretion. The result is the reduction of airway caliber. Hallmark is accumulation of inflammatory cells at the site of reaction. Early phase is vasogenic, spastic, increasing permeability with histamine dependent. The second phase is with action of leukotriene and accumulation of inflammatory cells, eosinophil, macrophage, neutrophil, mast cell, and epithelial cells, eutaxin. desensitivity therapy. It's a small amount of allergen parenterally, and that develop immunoglobulin type G against the allergen as blocking antibody. This is the way to prevent the formation of the bind of IgE with allergen. IgG against the allergen are blocker. The diagnostic is made by RAST, radioallergosorbent test, and prick test. This is the puncture of prick test in the skin. We can measure the level of immunoglobulin E and the account of eosinophil. As a conclusion, atopy is a familial tendency to make IgE more frequently against common environmental substances. Thank you for watching this episode of Medicine in 3 minutes. Make sure to put the like button and subscribe. Your comments are very welcome. Thank you.